Engagement is the new buzzword in journalism circles these days. But what does it really mean, and what purpose does it serve? Here at the USC Annenberg School of Journalism, we're encouraging journalists to try something new in their communities. Our National Health Journalism Fellowship is offering special $2,000 community engagement grants to a select group of reporters. We're asking grant recipients to try something we call impact reporting. That involves a fundamentally different way to connect with your audience. One way to think about community engagement is that you as the reporter spur new conversations in your community about the topics of your reporting. First, though, you have to be willing to share details early by promoting, querying, listening online, and in person at special community gatherings. Reporters call this an open investigation. It's a more interactive and inclusive way to capture community insights. Each project requires its own strategy, but these steps shape reporting and help build communities of interest that can help you later when the story airs. For one of our first community engagement grants, we gave Martin Reynolds of the Bay Area News Group a grant to add community engagement to an investigative project that explored the toll of asthma in some of the San Francisco Bay Area's poorest neighborhoods.
The one thing that I think this fellowship is unique is that it supports the notion that engagement is critical to the journalistic process. And so it's helping to spread that message to all of these journalism organizations, large and small, across the country. And that's really an important thing because it's serving a role, because if journalists can begin to collectively understand the need for this, the power for this, the payback for doing this, the industry as a whole will be better served.
A few years back, we gave Kate Long a fellowship to report on the high rate of childhood obesity in West Virginia, a state that often tops the worst health lists.
I wanted to do something that could change the conversation and put those facts on the front burner in West Virginia. I don't have the illusion that I alone could accomplish this. I knew I had to engage statewide organizations if I wanted a statewide conversation. And so very naturally, when I talked to the State Medical Association, when I talked with the social workers, or, with the Council of Churches, or whatever.
As she reported, she developed relationships with anyone who would further her outreach.
Let's face it, our circulation is declining, and any one media outlet anymore isn't in the position, unless you're the New York Times, to influence whole states of people. But if we think of ways, creative ways, to get that message out anyway, then we're going to achieve our goal. We're much more likely to achieve our goal.
Kate's series sparked a wide-ranging conversation that brought lasting changes to her state.
I think that a movement is happening, and that we have helped it happen. We didn't cause it to happen, we helped it happen. And as they said, we're tired of being fat. And they got together and they went walking in the early morning, and I went walking with them. That's another.
Community groups began to form exercise teams and gardening groups. Schools increased the amount of time devoted to physical activity, and politicians introduced new legislation.
And it's become a coalition of statewide public and private groups who have all decided that they can get a lot more done together than they could separately.
Engagement means building networks in your community that you can tap to gain information and share your stories. It means coming up with new ways that the community can continue to gather and think and talk and act, spurred by key issues explored in your work. So, what can you do in your community?